a little bit about getting treatment that maybe was not, in hindsight, the right treatment for you? Was there any misinformation or misconceptions during your journey with endometriosis that affected your treatment?
Absolutely. When we talk about surgery for the disease, for example, which is used to diagnose and treat it, um, it, as Dr. Iris Orbuch says, diagnosis and surgery should be not one and done, because that's not a fair assessment, but certainly it shouldn't be the path to multiple surgeries. You should be able to have the correct diagnostic procedure and the correct treatment. And we're talking about things like the difference between excision and vaporization. Burning the surface of a lesion is only going to leave behind multiple lesions, certainly deep disease, but also things like thermal damage and scar tissue and other things that result from just surface burning. When we talk about excision, that means going in and actually taking out the lesion by the root. Now, it's really not just about treating the lesion. And I want to make that point very clear, because this is a very multidisciplinary collaborative disease. Yes, you should take the lesions out and remove the disease from wherever it is, and it should be done via excision. But post-operatively, you also need to address that patient's additional needs, whether it's pelvic floor dysfunction through treatment by a specialized physical therapist, whether it's certain diet and nutrition components. There's a big picture approach and a collaborative approach that really needs to be taken here. And none of that was really done for me. I had to come to those conclusions by myself. And it's not okay that people are going still in 2021, almost 22, people are still going through multiple surgeries. Then they are blamed for their continuing pain when the surgery is done incorrectly. They're called non-responders. It's about the quality of care that's being given, but also when that care begins. Early intervention makes a difference. Collaborative care makes a difference. Integrative approach makes a difference. And compassion makes a difference. If you have a provider that is on your team and she or he or they are working with you to find the answers for continuing pain and symptoms, and they're really addressing that intersectional approach, you're going to come out on the other side much better than someone who is only doing surgery and sending you on your way without any kind of referrals to additional care. And that all matters. And when that happens is important. Symptoms can become very progressive, disabling, incapacitating. They can impact a person's ability to work, go to school, social functioning, impact relationships, their fertility, of course, their ability to have pleasurable sex. All of these things matter. So we really strive for early intervention and effective intervention. It's not just enough to give that diagnosis if it doesn't lead to quality treatment. So, we're big on referring to centers of expertise.